Are y'all ready? Y'all ready to go? Trey,
I'm ready. I'm going live right now
okay.
with the intro music.
You ready, Doc?
Yep.
Let's go ahead, Bobby D.
Give me enough time in the lag that I can get something typed before they start.
Questions? Oh, we'll give a few minutes. I'm gonna let him do an intro, and then we'll talk numbers, and then we'll start with some questions. Awesome. Good music. Sorry about that. Good evening. It's Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And welcome to our first COVID-19 Town Hall. With me tonight, I'm glad to have Dr. Craig DeLisi of the Family Care Center is going to join me for the next hour. Dr. DeLisi, you'll say hello?
Yes, thank you, Terry. It's a pleasure being here.
So tonight, guys, I'll give you a little heads up of how the next hour is going to work. It's informal tonight. I don't have a tie on, no coat on tonight. Got some information on the desk. Dr. DeLisi has his notes. We've got some water. But tonight is a town hall. And with social distancing and everything going along in the community, we decided, first of all, we didn't need to be in the same room. So he's in one room of the facility, and I'm in another room. So I want to say thank you to our marketing team and Bobby D, as he's known around here, for all the work that he did to put this together. It's our first experience with the Zoom and Facebook Live, and we're excited about it, and I love the way it looks. Our intro, I could have done a better job on, but I love the way it looks, and so now we're going to probably add 2 or 3 or 4 physicians down the road to make it a little more Brady Bunch down the road. But tonight is about COVID-19 and kind of want to answer your questions. So I appreciate over the last few days we've received your questions. We have them here on the table. We're going to go through quite a few of them tonight. But we're also going to have the opportunity to keep this live. And you submit your questions in the chat box that you see in front of you on Facebook Live. Put your questions in, and if they're covered in here, we'll cover them throughout the hour. And if they're not, we'll try and add them in and get to them. We are going to cut it off in an hour, and depending on how it goes, we may have another one of these with a few more people added on. And opinions that we can take a look at. But tonight's informal, and we're excited about this opportunity. It's been a lot of change in the last 2 weeks at Titus County and in Northeast Texas. We've seen an uptick in cases over the last 3 weeks, and especially in the last 7 days. That's why we think it's important tonight to answer your questions, and let's get the myths out there. Let's debunk some of them. Let's see what are we seeing on the front line, and get your questions out there so we're all on the same page. We want to be transparent tonight. So I hope you'll feel that way as we go through this process. But I'm going to open up and let Dr. DeLisi just talk a little bit at the Family Care Center and what they're seeing right now across town. Dr. D?
Sure. Thanks, Terry. My name's Craig DeLisi. I do work at the Family Care Center here in Mount Pleasant. I've been blessed to be in this community for about 17 years, seeing patients, and we've been busy over there, seeing folks since the beginning of this pandemic. But it really hasn't been until the last few weeks that we've started to see a significant number of cases. And as Terry mentioned, the last week in particular, there's really been a surge in patients. We're busy seeing folks upstairs and also primarily downstairs at our walk-in clinic. They've been seeing and testing people regularly and seeing lots of positives. We have, most of the people that we've seen have been a little bit sick. We've seen some that have been quite sick, and the majority have been scared. And so I'm excited to be able to be here tonight to hopefully answer some questions. I've been doing that often during the day, just as I interact with my own patients and friends and family, even from other places. but I'm happy to be here to be able to hopefully answer some questions people might have.
This is really cool, by the way. I'm having fun seeing Dr. DeLisi. Thanks, Doc. We're blessed at Titus Regional Medical Center in Northeast Texas to have the doctors that we have here. Our 100-plus providers that on the medical staff at TRMC are phenomenal. It's one of the blessings that on a daily basis that I want to make sure this community, Mount Pleasant in Northeast Texas, knows we're blessed to have Dr. DeLisi and his peers that are on staff here. Dr. DeLisi participates on a weekly basis in 2 different joint task force with COVID-19 with about 20 to 25 other physicians who were talking about what's going on with COVID-19 internationally, nationally, regionally, at the local level, and then how we as a health system are being prepared for it. Everybody knows me, knows I love numbers, so I'm just going to tell you, throw some numbers out there and tell you where we're at today. We've tested from Titus Regional Medical Center up until last night 765 cases. And that includes the mobile testing that was done by the county and the state of 120. So we've tested 765 cases. We have 109 positives with 136 pending. Now, that's just what we've tested here at the hospital. It doesn't matter what county you're in, Titus, Camp, Morris, Franklin, it doesn't matter. Whatever we test, and those positive 109 are what we're tracking today and what we've had over the last few weeks. We've seen an increase. Now, from a county standpoint, the county puts out state numbers on a daily basis. And if you go on the website, and I did about 3 o'clock this afternoon, the state has Titus County at 102 cases. The fire chief and the county judge, we're running about 145 to 150 right now of what we think the number truly is in Titus County. And there's just a delay. And I get that question a lot from people at the hospital, medical staff, and my friends on phones. Why are the numbers different? And it's a delay. I don't have access to ones that our doctors do, and there's other doctors around the area in Northeast Texas giving tests as well. And as soon as we get a positive, we get it to the right people. So the county's information is about as accurate as can be. So that 150 plus is what we're expecting. Now, I did mention we had 136 pending cases. We expect about 125 of them back by about 9 o'clock tonight. So we expect easily to be probably about 200 plus cases by the end of the day. And we've seen that increase over the last week. 2 weeks ago on May 4th, Monday, we were at 20 cases, and now we're at 102. From a regional standpoint, I'll put my glasses on just so I can make sure I get the numbers right. Over the last week, Northeast Texas, which is 18 counties, increased 37%. The state of Texas increased 25%. So you can tell we're growing, and the counties are around us growing. And there's a lot of reasons, and we're following from the different counties around us and our peers and medical peers as well in those different counties as well to see what they're doing. So the results are increasing, and we are starting to see more patients test more patients on a daily basis. One of the numbers I want everybody to know tonight and get in your head is 81%, 14%, and 5%. When we start talking about numbers of how many people are positive, 81% is the amount of people who are positive are going to have mild or moderate symptoms. So 81% of our positives will have mild or moderate symptoms. 14% are going to be severe, and then 5% are going to be critical. So about 19 to 20% are going to be severe, and they're going to be critical. So if we start talking about 120 positives, 10% of that's 24 people are going to be really, really sick. And that's what we're starting to see. Today, we have 6 patients that are positive on the floor in our COVID unit today, 1 in ICU and 5 on the floor. That is an increase. That's the largest number we've had in the 8-9 weeks that this has been since March 15th, since it's been going on. Some of the questions we'll have tonight, and I'll go back over them through the night, but we are transferring out some patients, not all. We have an ICU of 8 beds and a phenomenal intensivist group that can manage our patients here, and we have enough ventilators here as well to take care of them. But there are a couple patients, when they start getting severe based on the level of care, we'll send them out if needed, and we'll talk about that tonight. So let's go ahead and get started with some questions.
Can I make one quick comment?
You go right ahead, Doc. My apologies.
On the number of cases, I had someone ask today, I thought it was a great question. She asked me as a patient, she said, is the increase that we're seeing a reflection of actually having more cases in the community or increasing our testing? And I said, I think the answer is both. Really in the last couple weeks, so about approximately 3 weeks, we've really ramped up our ability to test freely and easily and conveniently, and because of that, of course, we've captured people that maybe before we wouldn't have known. But I also do think that we did so at the time when we're starting to see a lot more cases in our community. The state of Texas presumably spiked at the end of April, and most of us assumed that we'd be 2 or 3 weeks behind that, and that's where we find ourselves right now. And that's just I think, a result of geography, being far away from the city centers and being in an area with fairly low population density.
And you're 100% right. And I guess asked that question a lot as well. I will add on to that we are seeing very sick patients in the hospital and the ER that we weren't seeing at the frequency today that we were 3 weeks ago. So I understand we weren't testing at near capacity. We tested 70 yesterday. It went weeks before we tested 70 back in March and April. We tested 70 yesterday. However, we're seeing 10 to 12 to 15 people a day that are sicker in the ER and in the hospital. So I agree with you. The answer is both. So Dr. D, let's start off first question. Where can somebody get tested in Mount Pleasant if they're showing signs of COVID-19?
Sure. I think that it depends how sick they are is the short answer to that. If someone is really struggling with breathing in particular, then it might be appropriate for that person to go to the emergency room. I know there are other clinics in town that are testing, but I can speak with certainty about our clinic. So at the Family Care Center, we're testing. We're taking appointments during the day, throughout the day into the evening, and doing lots and lots of testing. Some of that testing is being done in the building, which creates its own logistical challenges, because if we have someone that we're suspicious of, we have to shut that room down for a couple hours. And then after 2 hours, have an extensive cleaning, basically almost a bleaching from the ceiling to the floor before we can reuse it. And we only have so many rooms. So some of the testing we're doing is out in the parking lot, seeing a patient in the vehicle, swabbing them right there. Yesterday, for example, I think of the 70 plus patients that they saw downstairs, we probably swabbed about 50 of them. So the short answer is you can get swabbed here in town. Again, I don't think we're the only clinic doing it, but if you're feeling ill and want to get tested, but don't feel like it's an emergency, you're not having significant difficulty breathing, then I would try to get it done in a clinic setting.
And one of the struggles is still testing. I said we tested 7 yesterday, but we're still not testing elective today. There's quite a few people who would like to be tested, and especially in businesses around who'd like to test 1 or 2 who may be in contact. But the problem right now is the supply and demand. We actually, based on the numbers Dr. DeLisi talked about, we ran out one day last Wednesday at the Family Care Center. We're able to get more that night and have been good to this point. But again, there is a limited supply of testing, and also the response time of getting the results back, of overwhelming the labs. We're working to try and get more testing in the area. The state is going to do more testing in this area. They're working with a local local business in town to do testing of about 2,000 to 2,500. We're trying to get some more testing just for the community itself. One of the questions is, will there be any mobile testing in low-income communities? We're trying to get that, and we're working on with the state, but also some other labs, some opportunities to do some more not elective, but kind of elective testing, so we can help prevent clusters. Because right now there's large clusters forming in Northeast Texas and Titus County in different areas, and if we can mitigate those, they may not have symptoms. I told you 80% or 81% will be mild or moderate symptoms and none at all. But if we can identify those clusters with some elective testing, we believe that will help. And we're trying to get that. Follow us along at our Facebook as those become available on Titus Regional Medical's website and the Facebook, and we'll let you know about this. Dr. DeLisi did want to add on to his. He did. One of the questions was, does the ER perform tests in the parking lot? I've heard of that and wondered if it was accurate. And the answer is yes. Dr. DeLisi addressed not only Titus Regional Medical Center, but the Family Care Center and other physician practices. If there are no symptoms of a patient, or they have symptoms but they're light, no comorbidities, which means no heart disease, lung disease, diabetes, liver disease, kidney, we may just get a test done in the car and drive by instead of exposing that person to the hospital. You don't want to take a negative person and bring them into a waiting room where they're positives in the ER. So if we can get that test done, we'll get that test done in the car if possible. Not done all the time. It's very rare, but you will see it. So you wouldn't be surprised if somebody goes to a car and does a swab. It happened yesterday at one of our clinics as well. So good questions. What if my doctor says I don't need a test, but our family members continues to have high fevers and symptoms?
I'll answer that one, Terry. So whether to test or not, certainly there's clinical judgment involved, and because resources aren't unlimited, there does have to be some deciding points on whether or not the concern for having the illness is high enough to warrant testing in a given situation. So there may be times, and I know there have been many, and I've talked to patients where certainly that's happened, where somebody has had some symptoms, assumed that they needed to be tested, went and saw a physician or a practitioner, and ended up not getting tested. I think until we get to the point where there's unlimited resources, there'll probably be some degree of discretion where that happens. But in the scenario that the person who asked the question was asking, if someone has symptoms and is decided not to test them, and then they worsen significantly, what I would recommend is that you also then contact your healthcare provider. It might mean going back to the office and reevaluating. I saw a gentleman yesterday that was seen a week ago. Actually, I saw two people yesterday that were seen about a week ago, had some symptoms, but it was decided not to test them. But when I saw them, they were a bit worse, and so we tested both of them. So I think that those sort of scenarios are likely to happen. There may not be a guarantee that you'll get tested if you go back, but if your symptoms are worsening, especially respiratory-wise, especially if you're really having a difficult time breathing, then I think it's important to reach back out and make contact.
One of the questions came in online: can you get tested if you have no symptoms but you're high risk? And I think you talked just about that. I think you need to talk to your provider. And in that situation, if you're at high risk, hopefully you have a primary care physician in this area. You need to talk to your provider on that. And really that decision needs to be made by your provider who knows you and your symptoms.
Yeah, and the other tricky part about that is the utility of checking someone who's asymptomatic, it doesn't have any symptoms yet, is fairly limited. Even though we do know there'll be asymptomatic patients, where you are in sort of the timing from exposure to contracting the illness really affects how effective the test is in saying whether or not you have it. So if you're tested very early, for example, we've seen this several times, someone comes in and says, hey, my household member tested positive yesterday, I would like to get tested. They come in and have no symptoms at all. In some of those cases, we've tested the patients and say, for example, it came back negative. That doesn't mean, one, that patient wasn't exposed. Two, it doesn't mean they won't contract it. It could be that 2 or 3 days later, they do now have symptoms. And so really, we're trying to encourage asymptomatic people, for the most part, not to be tested. If there's an exposure, especially a household or very close exposure, they do need to assume that they've been exposed and could come down with it. So they do need to self-quarantine and be on the alert of for any symptoms. If symptoms do come, then we do want them to come in and get tested.
Can we let's talk about that self-quarantine real quick and make sure, because that's in some of the questions here, but it's a great point you just brought up, that if you are tested positive, you do need to self-quarantine yourself and the rest of your family. And there is a good chance that the rest of your family has been in contact, but if they don't have symptoms and you are tested positive, you need to self-quarantine. You need to constantly clean, and separate yourself. And if another member of the family then starts showing symptoms, then they're going to need to quarantine themselves and isolate themselves from other members of the family. Right. So just don't say we're going to quarantine the house so we all have it. No, that's not the safest thing to do. Quarantine, isolate, and try and prevent the spread if at all possible.
Go ahead, Can I add one thing to that, Terry? And what you just said about the household member, what we've been telling our patients, if we swab somebody, in other words, our suspicion's high enough that this could be COVID-19, that we're swabbing them, we tell them to consider everyone in their house exposed, and from that moment until we have a result, that those people shouldn't be going to work. They should be treating themselves as if they're likely to be positive as well, at least in the near future. And I do think that's important, because we've heard of many scenarios where someone in the house was tested, or maybe even someone in the house was positive, and those other family members continued working. And I think that's concerning and really an efficient way to spread the illness, unfortunately.
We can talk for hours about this stuff, because this is some good stuff. You talked about numbers on number of days. I want to throw a couple days out there, Dr. D, and give everybody their head, because it's a good way to think about it. 3 to 4 days after that you come in contact with the virus is about when, at the earliest, that you're going to show positive in your system. Right. 4 to 5 days, actually, before that you'll actually be contagious. Is that correct?
As far as we know, unfortunately, there's a really wide range of the incubation of this virus, and it's one of the things that's made it difficult to control from a public health standpoint. Theoretically, you could contract symptoms as early as 2 days. That's unusually soon, but of course, it can be as long as 14, which is where the 14-day quarantine comes into play. and that's difficult. But it's usually not the day. It's not the day or the next day from the time you're exposed that you would start to become symptomatic.
You are contagious, though, probably before you show positive. Is that correct?
Right. Yes. So they assume that
I think I had my numbers backwards. I think 3 to 4 days you're positive, 4 to 5 days you'll show positive, but you're giving symptoms out at you're giving the virus out at 3 to 4 days.
That's correct. And so, yes, certainly, probably the day or two before your symptoms start, and that's the case, by the way, with almost every illness, every viral illness. You are shedding virus in some ways, and probably, of course, exposing people if you're in close contact and don't know it.
And I'd also ask people to watch those numbers and watch those days, because day 8, 9, and 10 is where we're seeing our severe patients take a downturn. That day 8, that day 9 or 10 is some of the severe days for that 20%. That is severe and critical is what they're seeing. So, Dr. D, talk a little bit about the antibody test and the serum test, and just the difference in the two and what you do at Titus and your thoughts.
Sure. So, at this point, and I think we'll see other types of tests that'll cause more confusion, but will be welcome if we can find some rapid tests. But right now, there's really just two different tests that are available to the general public, and certainly in this area. One we've talked about extensively, and that's a nasal swab. It's a PCR test that's very accurate. In other words, when it's positive, you have it, and so it's not going to say someone's positive if they do not have it. Unfortunately, depending on the timing of the test, the technique of the test, and even in a given person where the virus is in their body, sometimes it can miss cases. So probably in 20 to 30% of the cases, someone can have the coronavirus and test negative with the PCR test. That's the one we're doing. That's the swab that everyone's concerned about. The second test are the antibody tests, and they are blood tests, and they are a way for someone to know if they've recently had or if they've had the virus. I shouldn't say recently. There are three different ones that can be checked. Typically, we check one that's called IgG, and it usually doesn't start to appear in the blood until about 8 days after exposure to the virus. And after 8 days, the tests are decent. So most of the tests we're using right now, the lab we're using, has upwards of a 95% what we call sensitivity and specificity. Sensitivity means you don't miss people who have the test. In other words, there's not so many false negatives of people who have had it. And specificity means that you don't say someone had it when they really didn't, so a false positive. And so, in my opinion, the main utility of these tests at the moment are for people who think that they were exposed and just want to know if they were. I've run probably at least a dozen in the last week on patients who have called in and said, I had that illness back in February or March. I didn't get tested. Can I see if that's what it was? I had one was positive, the rest were negative. My hunch is that there's not going to be too much of that from people who've just been in our community, because I don't think the virus has been here in full force until the last few weeks. But there may be some, especially people who travel to higher risk areas early on. And the benefit of knowing and having that test, of course, is that it is a sign that you've been exposed already and your immune system's fought it. And that probably means that there's some level of immunity because you had it. The big question is, what does that mean, and how much immunity, or how long do you have immunity? And we do not know that yet, which we'll learn more, just like we learn and study other viruses, but we don't, because this one's new. Does it mean that you're unlikely to contract it again if you're exposed in the next month? Does it mean you're good for 6 months? We don't know. But I will say that I'd much rather have a positive antibody test than a negative one at the moment, because it almost certainly does confer some immunity.
But I would encourage people just to come to get an antibody test when there's so much in the area. Social distance and stay away. I appreciate that explanation, because we get asked the antibody test a lot. But I want everybody to understand, when we start talking numbers, the PCR, the serum test, is the one that we're using for positives. So when you see the state's numbers or Titus Regionals, we don't do a positive antibody test in our numbers that we're tracking. So it's the real test that's being done with 100% accuracy in there. So I'm going to read some questions, Dr. D, on these as they're coming through, because they're coming through Facebook. We have ours here, but I want to hit a couple of these. And a couple of politically charged, so I want to be careful how we answer. Do you feel it's possible to safely resume sports such as baseball, little leagues, and that? and again, I'm gonna give my personal opinion at this time is we're increasing dramatically in Northeast Texas. I'm going to urge the community, my friends, my family, to continue to social distance, to continue to wear masks, to continue to sanitize on a consistent basis. I don't think it's time to start sports back. And if you know me, I have coached and been yelled at by many of you over the years doing Little League football, basketball, and baseball. I'm one of the biggest sports fans for Little Leagues in Northeast Texas. But this is not the right time with the cases increasing like it is. The next 3 to 5 to 6 weeks are going to be determined on how we handle it from a standpoint of Northeast Texas and COVID. Doc, your opinion?
Yeah, I appreciate your boldness in saying that.
I know
those are dangerous words, but no. I will say this first of all. I do think outside sports there's a lot lower risk than indoor, but probably the simplest way I can answer the question is my son Kalen, who's 14, was signed up to play at the Mount Pleasant League before all this started, and then the league has since resumed, which surprised me. And last week I did talk to his coach and told him that we were not going to play. And for us it seemed a little early, seemed a little premature. And then
that's a bold statement.
And then
call me bold. You're bold.
And then adding to that just the extra element of him being my child and maybe being at higher risk of having something that he could pass on to someone else. And that was a hard decision, honestly. I mean, baseball's fun.
It's a tough one.
Yeah,
it's a tough one. Another one about taking your kids to the store. I mean, when you're going out, you want to address that one or?
Yeah, I wouldn't unless you really needed to, which I can't think of too many reasons that you need to.
I agree.
I mean, I assume if you had no one to watch your child, of course, and you had to run in, you can. They don't do as, and I can speak with some expertise on this one because I have a lot of children, but they don't do a great job of keeping their hands off of things or of staying away from people. Mine, I think wearing masks is fun. But certainly the younger they are, the harder that is to do. And so in general, I would encourage not doing that.
So for our town hall people, Doc, who do not know how many kids you have, you want to go ahead and you want to go ahead and tell the DeLisi family?
So we have 12. My wife and I have 12 kids. My oldest is 20 and our youngest is 5.
And if you've not seen his PSA from his family on wearing a mask, I encourage you to go to Titus Regional's Facebook, and it's a great video, and we're appreciative of it. One of the questions here is the heat going to kill it? And I want to thank Dr. Kahn for all the information that he has sent me over the last 6 to 8 weeks of his study of this, and the answer is nobody knows. But when you look at places like Australia, yes, they have COVID, but if you look at the instances of COVID in Australia, it's a lot lower than the United States and even in Texas, and the spread is not near the same. If you look across the United States and look at the numbers, the good humidity, cool air, colder areas are seeing to get hit harder than some of your warmer types areas. So I think that's gives you a little bit of things. Dr. DeLisi can talk a little bit about just viruses and heat and cold, but that's kind of what we've studied.
Yeah, viruses tend to live better in cool environments. I don't think it's as simple. I wish it was, especially living in such a hot state that I don't think that the virus will evaporate or disappear completely just when we do get into even our hot summer. I do think it probably slows the spread a bit. And we see that with all viruses. There's always an uptick in the fall when it gets cooler, in the winter. There's other reasons other than just the virus is surviving in the temperature differently. Of course, when it's cooler, people tend to be indoors and around each other more as well. But I don't think we can look to that as kind of being our savior that may end or really cause a long pause in the cases that we're seeing.
On the same note, there was one of the questions that says, why are they needing to test for flu when they have positive family members from that? Why are you testing for flu tests and strep?
Yeah, I can only speak for myself at the moment. We're not doing that every time. Yep. At this moment, the 3 I've tested this week so far, I didn't check any of them for flu. We were initially, and we still are in certain cases. And the reason is we're still seeing flu. Most people don't realize that flu we have spikes at certain times of year. We have our flu season, but we see flu sporadically throughout the year. The symptoms that you present with influenza are very similar to what you do with coronavirus. And so if it is influenza, this is one of the few times people are just thrilled to have that, partly because we know what to expect. It's less serious and we do have treatment available. So It is checked for, but I would say not every time, and I think that it'll be case by case.
So what are you doing for the treatment for your sicker patients that are positive of COVID? How are you treating that? I get asked that a lot.
Yeah, and I think you have to think about that in two ways. Inpatient and outpatient. And inpatient is where the majority, the bulk of the research is right now, and I think what most people need to understand. I'm sure it's frustrating reading different news headlines every day, and maybe even trying to scroll through the internet and look at medical studies because it looks like nobody knows what they're doing. And what you have to understand is that when there's an illness or disease and we're trying to learn the best treatment, you have to have well-designed studies on large enough groups of patients to know what's truly effective and what's not. What we don't want to rely on is anecdote and just individual cases, or what we call observational studies, where you look at a small group of people, 10 people or 20 people, and then make broad conclusions. And so those larger studies take some time. They're difficult to do because you have to be giving some patients a certain medicine and then other patients probably a placebo. And you can imagine the challenge in that, and then analyze things at the end. At this moment, the inpatient treatment that seems to be most effective is remdesivir, and it's an antiviral drug. It's been used to treat Ebola. It's shown some promise, and you're seeing it used and distributed even to states. It's not readily available for everybody, and it's an IV medicine, so it's used inpatient. Yep. They're also using plasma, which is the liquid in the blood, not the red blood cells, but the watery part of the blood that contains antibodies for patients who have recovered. It's called convalescent plasma. That's being administered intravenously to patients when they're sick and in the hospital, and that's shown some promise as well. However, on the outpatient side, the story is a little different. And at this moment, there is not a consensus on what's the best treatment to use. The majority of patients who have this as an outpatient do not get a certain specific medicine. There was a lot of hope in the beginning that hydroxychloroquine and azithromycin would be effective. And I don't know that the story has been, the final chapter has been written on that one. But the larger studies that were done, the well-designed studies, unfortunately did not show a lot of benefit. And so that's one of the big difficulties. And when people ask me what I think will have to happen to bring an end to what we're seeing, or to really, really change things, everyone's looking for the game changer. The two things that come, the obvious one, of course, is an effective vaccine, which we can talk about later. But the other two are number one, very effective inpatient medication that makes a big difference in mortality. Something that can keep people off the ventilator, something that can cause the mortality rate in ventilated patients to go way down. That would be huge. But the second one, that just from a number standpoint is probably even bigger, would be an effective and available outpatient medicine. In other words, someone that we see and they're on day 2 of symptoms, and it's a medication they take orally that radically decreases their chance of decompensating. And as of right now, we do not have that. And I hope and pray that the Lord will help us discover something that will be effective. But at this moment, we don't.
You talked about inpatient, you talked about plasma. Just from a Titus Regional Medical Center standpoint, we have given 2 instances of the plasma being given in the ICU for patients, and one had a great recovery, and one is in recovery right now, who got the plasma. Also, we get asked a lot about why are we transferring out some of these patients from Titus Regional. And we make that decision either in the ER or when they're up on the floor. We have a COVID huddle that was formed now where several doctors are getting together on each COVID patient and the clinical and nursing staff to talk about the care plan. And they're doing a great job of putting a plan of care for COVID-19 in place. And if a decision's made that patient may need a higher level of care, we're transferring that patient quicker than we did maybe in other different type of diseases that we're dealing with. We've seen in COVID-19 patients turn around quick. Within 24 hours, go down the tube real quickly. So we're trying to stay ahead of that. There are some things that we do not offer in Titus Regional. We're a very well-equipped health system. We have 10 ventilators right now. We've not even come close to using the ventilators we need, but we don't have a prone ventilator where you'll turn somebody up on their head, ECMO. We don't have that ability yet. And there's not even hospitals in East Texas who offer that. They'll need to go to Dallas for that. We've had good luck of transferring a couple patients to Dallas for that, and some have had to go to Tyler. But we make that call, and if they need to be intubated quick in the ER. I will say, when the people have said, we're just testing more, no, we're seeing intubations in the ER. It's real. That 5 to 10% that you see that are critical, when you intubate in the ER, that's not normal in healthcare, where you have to intubate somebody with a virus in the ER. We have seen that. So that's the reason why we're transferring out. I have to give a plug to our team. They're doing a phenomenal job in the inpatient, the nursing staff, the lab, the imaging, the doctors to taking care of these patients, and they're getting great treatment on a daily basis. Doc, you talked about vaccine. You want to address it because it's a great question.
Yeah, a vaccine. First of all, we all hope, of course, that there will be an effective vaccine that will be discovered. There's lots of companies working on it. There seems to be, I think, about 8 that have made some real progress. And if and when that comes, that can potentially bring an end to this, maybe even permanently. But there's so many variables there, and I think what most people do realize now, and maybe didn't initially, is just how long it takes for that to happen, and that there's a lot of unknowns even when you are giving a vaccine. In other words, how long will the vaccine last? How long will the immunity that's conferred last? Will there be mutations of the virus that need to be vaccinated for regularly or yearly, like the flu? And we don't know that. I've read most recently that they think that possibly by January they could have something. Which seems like a long way away, especially when you see how different our world is. But that is, by vaccine standards, lightning speed. I mean, most vaccines, from the time of creation to the time of mass production are years, 3, 4 years. And generally it's, of course, because they need to be tested on lots and lots of people before you see, 1, if they're effective, and 2, if they're safe. I heard someone say the only thing worse than no vaccine is a bad vaccine. And I agree with that. If we start pushing out to billions of people, which is what will happen, a vaccine that's dangerous or has a significant side effect or isn't maybe super effective, that's much worse than not having one at all, in my opinion.
So, Doc, I got a couple questions here that we're talking about. There's a bunch of people who are sick or feel sick there, have made some documentation status or do not have insurance, and they're afraid. I want to encourage everybody to get help. Go to your provider, family care center, emergency room if you need help as well. We're focused right now on COVID-19. And if you're uninsured, there are programs for the government to pay for those testing and to pay for that insurance. So you can get the necessary testing that you need right now. So insurance should not prohibit you from getting treatment, and your documentation status should not prohibit you in any way. So encourage your neighbors or relatives or friends who may be worried about something like that to seek help. We have the COVID hotline that's on our website they can call as well. One of the questions we had come online, Doc, was about if you're too sick to come in. I just want to give a plug out to you guys and video visits, and you're seeing patients in the home right now. So if you're too sick to come in, you're definitely can do a video visit with them. You want to comment a little bit about video visits and your impact?
Yeah, that's been something new for us. I know other places have done it, but we started right at the beginning of this. I'm sure, like most doctors' offices, doing the telehealth visits or video visits, and patients have really liked those. And they're limited. There are things you can't do. You can't listen to someone's lungs. You can't check their blood pressure or their oxygen status. But some patients were either nervous about coming to the doctor or they felt too badly that they didn't want to come. And so we just schedule like a regular appointment, a video appointment, and the nurses check them in, and we communicate like this. And in some of those cases, if someone looks pretty bad, the conclusion might be you need to really come in. We need to do a chest x-ray. We need to do lab work or check your oxygen level. But that is an option for folks. And they would in the case of our clinic, I'm sure it's the same with others, just call the regular clinic number and just ask to schedule one.
One of the questions we had talked about tracing and who's responsible for that. The health department is who we report all positives to, and providers across the nation provide a health department. The health department in the state of Texas are then doing tracing. Now, I want to give a plug out for Paul Lindsay, detective with the Titus County, and Dr. Burling. They're doing a lot of tracing within Titus County to take those positives and try and do, from a tracing perspective, identify who's been in contact with COVID-19. With the increase, it's becoming more difficult. but there is tracing being done at the county level and the health department. From a Titus Regional Medical Center standpoint, all of our positives we're calling and checking on consistently. We want to consistently follow them up for a minimum of 10 days from when they tested positive to make sure that there are no issues. Like I said earlier, this does turn around real quick. So we're looking for any of those things where we need to set up a video visit with their doctor or come into the ER. Again, I've never wanted encouraging people to come to the ER, but I do want to encourage people, don't wait too long. This virus and this disease does act quick. So if you are short of breath or coughing up blood or anything like that one, don't wait around. Call 911. Call EMS. That team is trained to help you. Don't wait. Rather be early in this situation. It is real when you get in that. So don't wait on this. I also get some questions on death online. They send us that they know a friend or somebody passed away in this, but it hasn't changed the reporting that's on the state. I would encourage everybody to be very patient with the reporting on the state. I'm not sure the timing of all that. We have 2 reported deaths in Titus County. One we're not familiar with and one we are familiar with. Eventually those stats will be updated. We hope that's it. And we hope we can prevent any more deaths in Titus and our surrounding counties by implementing the procedures that we have. Nursing homes, I want to give a shout out. I talked to one of the nursing homes today that I have a good relationship with, and the testing, I believe, is completed in Titus County. There was a federal mandate and then a state mandate that all nursing homes, patients, and employees be tested. I do know that starting on Saturday or Sunday that the state and the National Guard, State Guard, were in Mount Pleasant testing, and they tested all the patients. I think the final tests were done yesterday, so all of our nursing homes have been tested, and that was a national initiative put on by the federal government to look at. So, but I did have that one. We're also starting to see testing as we start increasing. We do have, we're in an industrial area, and I've given shout out after shout out to our local employers. I think they're bending over backwards to do everything they can across Northeast Texas to prevent the spread. The state is working with one of our local employers to do some testing. We're going to test probably between 2,000 and 3,000 tests to try and help with that. We're also going to try and get some additional tests to do some mobile testing for other employers in the area. And but again, I get questions about is it required to be tested and that, on those businesses, I don't want to get into specifics of that and like to leave that. I do know that all the businesses in town, we have talked closely with all of them on a consistent basis. Dr. DeLisi's been on several phone calls with several of the industry leaders in town. I encourage them on different things, giving advice, and I've been blown away about how much research they have been doing. I would encourage anybody on your questions, the CDC, which you can get to our website and the City of Mount Pleasant's website, is a great resource for a lot of different information, anything from masks to washing hands to that. That information's out there. Let's go through a couple more, Doc. How about, can you explain the importance of masking in public? What are some important do's and don'ts with wearing a mask? Is my health at risk when I wear a mask? Lack of oxygen, carbon dioxide, etc. And talk about gloves as well. How about those two?
Sure. Yeah. So I definitely believe that people should be wearing a mask in public if they're indoors, if they're going to be around other people. I know people don't like wearing masks. I don't particularly like wearing a mask all day at work, and I don't think many of the medical staff do either. But realize that it's really one of the most effective tools we have to help prevent the spread. When you wear a mask, realize that for most masks, I don't have a regular one near me, but not the medical kind, not the N95 kind, but the cloth kind or the surgical mask. They're not wonderfully effective at preventing you from inhaling viral particles if you're around somebody, for example, who's coughing with coronavirus. But what they do a fairly decent job of is keeping your germs to yourself. And so when you're wearing one, you're really wearing it for the benefit of others. And what I've noticed, the trend just being out in the public, of course, when it was mandated, everyone wore masks, people were wearing masks. And then as soon as they said it's not mandated, it's just recommended, hardly anybody was wearing masks. I've seen the pendulum swing a little bit back, and I've seen a few more, which I'm glad to see that. But I'm seeing it more in the older population. And I think it's primarily because they're concerned about contracting it. And I think the younger folks, the 20s and 30s and younger than that, who aren't as concerned if they were to get sick because they don't think they would become as ill, are not wearing masks. And what I've tried to encourage patients and people I see is just that you're wearing it for those other people. Yep. And in my case, for example, I don't know if and when, at what time I may become infected. So when I leave the house, I consider myself contagious, and I don't want to go be near someone in an environment or in a store and potentially infect them. And I force my kids to do the same, which some of them don't mind, and others of them don't really like, but they've been respectful. So that's the thing. So that's mask. Now gloves, on the
Before
other
we go to
hand.
gloves, can I ask you a question? Because we're getting
Sure.
online, they're lighting up. Is there any risk of wearing a mask?
Oh, right. Thank you for asking that.
problem.
So I would say no, there's not, and especially not the surgical kind or the cloth kind. I realize they're a little uncomfortable. I do realize that they do make you feel slightly short of breath. They're not going to substantially or probably even measurably decrease your blood oxygen level. And so I did. The first time I heard that was just this past week. Someone said that they had heard that it's endangering to themselves for wearing them. That's not the case. I mean, these right here, the ones that are sealed around the face and very thick, they're harder to breathe through. But even in those cases, I mean, there's hospital employees and people in industrial environments that are wearing them for 8-10 hours straight and not passing out on the floor. So no, they're not dangerous. I think that they're well worth it and not going to harm you, even if you have lung problems.
Gloves.
Yeah. So gloves, I think it's very important to keep your hands clean. If you are OCD with sanitizing and have hand sanitizer, which not everybody has, then you probably can keep your hands thoroughly clean by doing that. I don't think it's wrong to put on gloves if you're going somewhere where you're handling lots of things like the grocery store. I've seen some people doing that, my wife included. And I don't think that's wrong. It's easy just to peel those off and be done and know that none of the germs from the store are on your hands. At the same time, if you keep hand sanitizer in your purse or in the car and clean your hands thoroughly, I think that's okay.
So, guys, we got about 10 minutes left, and we'll probably start at 5:33, so we'll go to 6:33. I'll hold Bobby D and his team over a few extra minutes since I started late. So if you have any question that we haven't answered or a topic you feel like we weren't transparent enough or you'd like more information, send it online, put it on Facebook, and Tracy will get it to us and we'll address it. A couple of things that I know we've been asked that from a PPE standpoint, Titus Rouge Medical Center, our equipment and supplies, we're in a good place. Our team, Reese and Chris Bell, and everybody involved, they've done a phenomenal job of making sure we have all the supplies and PPE needed. We're good on that. Ventilators, Lindsay and her team have done a great job in respiratory therapy. We have all of our ventilators are working. They've got other options as well that they've done the research on if we ever needed. The floor we have 20 additional people on the COVID floor. So we're good from that. Now, staff, it's tough. I mean, our staff we're asking a lot of right now. So if you live with a healthcare worker or friends with a healthcare worker, please give them a pat on the back. Say a prayer for them. Give them a hug in a social distance, comfortable way. So don't touch them, but just tell them you're hugging them. They need it right now. We're asking a lot of our staff, and to our nurses on the floor and doctors, thank you. And our EVS, our cleaning people who are going in, we're asking a lot. We're going to be we're going to have just enough staff to get through it, but we don't have a lot of staff extra. So we'll be looking at some options there as well. But that's the biggest one. We're asking a lot of our team members right now. A couple of the things, visitation policy. We still had a no visitation policy at Titus Regional. As of yesterday, some hospitals started opening up and allowing one visitor. At this time, as the CEO of this hospital, I can't justify opening up visitation hospital patients yet. With the increase over the last few weeks and with the rise of the COVID floor, the number of people we have on, we're about 2 weeks behind everybody else, as Dr. DeLisi said earlier in the town hall meeting. So we're probably at least 2 weeks away from we can talk about visitation and those types of things. Now, surgeries and procedures, we're continuing. We're being smart about them. Not all of them will be able to continue, but we'll try and do as many of the elective procedures that warrant procedures that require inpatient stay, and that probably won't be able to be allowed right now. But the cath lab is going, the GI lab is going, and elective procedures are going. Those procedures, since it's just day procedures and they're in for a few hours, one guest is allowed to be with them. For labor and delivery moms, we are allowing one designated person to stay with that mother through the whole pregnancy, and they have to stay the whole time with them. And I know that's frustrating to a lot of grandparents and other spouses because I get those texts from you, and I'm sorry. It's a tough time, but we're trying to protect your daughter, your son, your new grandbaby as well. So this is for the best for them. So the visitation policy is still today We'll make an announcement, we'll make a change, but at this time this week, we're not ready to make a change. The other one I get questions about a lot is the wellness center. The governor did open up gyms yesterday. We don't have a gym, we have a wellness center. And we're doing some great things, and we miss our members of our wellness center, 1,500 strong, who are very vocal and come out on a consistent basis to work out. Given what's going on in the community, we do not feel it's safe at this time. Our wellness center is at the bottom of one of our physician buildings. There is COVID-19 in that building. There is that from there. So we want to make sure that they're safe and we keep everybody safe in that perspective. So we are going to continue to leave it closed until the middle of June, and we'll look at it towards a middle of June or July opening when we feel it's a safe environment that we can open up the wellness center for all of our members. So to our members, sorry about the delay. We do believe it's the safest thing and the right thing to do given what's going on in Northeast Texas. Let's see if we have any more questions. Doc, we got about 5 minutes left. Anything you don't think we covered that you think we should address with everybody?
No, I think that one thing that's important for people to understand as far as transmission is that certain environments are more high risk than others. I think, the exposure to virus over periods of time, especially in indoor settings, is really where you're at higher risk. I've been trying to encourage patients, especially knowing that people in the community have it, that, if you were to pass by someone who had the virus and was actively infected, unless at that moment you were passing them, they turned and coughed in your face as you were inhaling, the chance of you getting exposed to enough virus to become symptomatic is very small. But on the other hand, if you were sharing an office with somebody, or you're in the home with somebody, or you're in an indoor building with somebody for an hour or two, breathing the same air, those environments do increase your risk. So as you're deciding where to go and what kind of things to do, consider that. I think that's an important piece of it.
We talked about quarantine earlier, about following up from people who are quarantined. I said earlier, we are calling them, checking symptoms on a daily basis, and encouraging our positive cases in Northeast Texas to quarantine themselves, stay home, quarantine themselves and the rest of their family. But I do want to make sure, you ask all the time, what can we do to follow up with that? What we can do from a legal standpoint. Again, all we can do is encourage people to stay home, talk to them about the pros and cons, about how they're hurting themselves, how they could impact their family. And I will tell you, I've been very impressed by Northeast Texas on how they've accepted that challenge, and they are quarantined. There are a few examples, and we have to talk to them and find the right person in that person's life to explain it to them so they know how important it is. A couple more questions that we have. Hey, Doc, you said earlier about, I just want to follow up on about getting it a second time. I want to make sure, that question's been asked. You talked a little bit about it, but will you just address that one time? I talked about if you had positive, can you be positive again?
Right. So the short answer right this moment is probably not, at least not in the short term. We don't know how long you'll be immune to the virus if you do have it. Some of the suggested data early on in China where people tested negative and then tested positive, again, in a week or two, they really think that it's probably the same virus that was just not picked up in those in-between times. So if you do have it right now, for example, you probably won't get it again for some amount of time. Now, what is it? Well, is that amount of time 2 months, 3 months, or a year, or forever? We don't know that. I don't think we'll know that anytime soon.
So staying on that same, what is your final words of encouragement to our community, to your patients, or to your fellow church members that you haven't been able to see, and those types of things?
Yeah.
What advice would you give to Northeast Texas for the next few weeks?
Yeah, thank you. So Terry, if I could say anything, a couple thoughts I have. One, this virus is here. It's here in our community now. We're going to have a lot of people that get at least a little bit sick. And we'll have some that get very, very sick. And we've seen that even in the past week. Last week, one day at our clinic, we had 40 tests we had done the day before. We had 25 of those were positive. And the day we called them all to give the results, 2 of those patients were already in the ICU. And just as our numbers go up, we're going to see patients who do get particularly sick. And with that, of course, there's suffering and there will be some death, and there has been. And with that comes fear. And on the one hand, I want people to treat this soberly and realize that we're dealing with something that's been unprecedented really in our lifetime, and not to blow it off as being trivial or insignificant. I think that's a wrong response. I think that's an overreaction to being inconvenienced and life coming to a screeching halt. But on the other side, which I've certainly seen more of, has been a lot of fear and anxiety and worry and times paralyzingly fearful. And I just, if it's okay, hope so. I just want to read briefly out of the Sermon of the Mount, just some words of Jesus in Matthew 6, if that's all right. This is Jesus in Matthew 6, and he says, "Therefore I tell you, do not be anxious about your life, what you will eat or what you will drink, nor about your body, what you will put on. Is not life more than food, and the body more than clothing? Look at the birds of the air. They neither sow nor reap nor gather into barns, yet your heavenly Father feeds them. Are you not of more value than they? And which of you, by being anxious, can add a single hour to his span of life? And why are you anxious about clothing? Consider the lilies of the field, how they grow. They neither toil nor spin, yet I tell you, even Solomon in all his glory was not arrayed like one of these. But if God so clothes the grass of the field, which today is alive and tomorrow is thrown into the oven, will he not much more clothe you, O you of little faith? Therefore do not be anxious, saying, what shall we eat, or what shall we drink, or what shall we wear? For the Gentiles seek after all these things, and your heavenly Father knows that you need them all. But seek first the kingdom of God and his righteousness, and all these things will be added to you. Therefore do not be anxious about tomorrow, for tomorrow will be anxious about itself. Sufficient for the day is its own trouble."
Dr. DeLisi had a couple things that I was going to go over before we said goodbye tonight. I can't. That was a perfect ending to the town hall. Could not have said it any better myself. So I truly appreciate you sharing those words from the scripture and ending this first hour that we've done. We look forward for many more. But again, thank you for the opportunity to share the screen with you tonight. Thank you for what you do for our community. And to Northeast Texas and Mount Pleasant, thank you for all you're doing for this health system, and thank you for joining us tonight. We look forward to doing this again over the next week. Please social distance, wear your mask, and sanitize your hands. Have a great night.
Thank you,
God
Terry.
bless.
I appreciate you.
Thanks, Tom.